Next, we're going to review the documents that we look at before every appointment. So we're going to work from our schedule here. We could also, if we wanted to, search for client in the client search bar, but I prefer to go through my daily schedule. So we double click on the client's name to open up the chart. And this brings us to the chart cover sheet, basically a cover sheet. Has all the basic information that we'll need for the patient, including the basic demographics, the specific office that the patient is assigned to, which is important information to have for when you're going to be scheduling their next appointment. So just be aware of that. The patient's date of birth, their age, social security number. Here, the contact information would be the phone number you would call for your appointments, or any other ways that they want to be contacted for appointments. Call log tells us who's tried to call them and when. Active programs tells us their whole care team, therapist, nursing, case management, and then our MedSom provider. Any upcoming appointments they have, and any scheduled appointments they've had. And sometimes those are the kept appointments in the past, and sometimes they're scheduled appointments for the future. So there's usually about 10 appointments there. So just something to review if you feel like you want to know when they were last seen by therapy or case management, etc. Up here we have message board, which is where we'll have notes like it says here, needs consents, if consents are needed, if they have an alternative pronoun that they want to use, or an alternative name or nickname. Any other special accommodations that they need for appointments would be listed here. Here we'd see the diagnoses, and that would come from the DA, which we'll review in a minute, but those would be on the face sheet, so nice and easy to find. Any treatment plan information here, as well as any service documents that need attention. Those would be listed here as well. Any financial information goes here. It's really just a snapshot of all the information for each patient. So before each appointment, from the chart, we would look under my caseload. So the first things we would look at would be under path assessment documents, which are the core information that we need, which is either the adult diagnostic assessment if it's an adult over 18, under 18 diagnostic assessment would be here. And then the health history questionnaire is located here as well. And those two pieces of information, the diagnostic assessment and the health history questionnaire, are completed before we see the patient for the first time, typically. So let's look at the diagnostic assessment quickly. Now these are empty, but it's just to give you an idea of what can be found in them. And these diagnostic assessments are very comprehensive. Starts with the date, who completed it, any presenting problems, any history, how long their symptoms have lasted, any changes recently, anything that caused whatever is happening in their current situation. This breaks down all their problem checklists, pain management, depressed, any bereavement issues, anxiety, oppositional behaviors, mood swings, substance use, just the basic information about that. Any sleep problems for children, any kind of problems with enuresis or encopresis, any psychosocial stressors, any deficient skills that we need to identify here, their living situation, who they live with, family members' names, any social information, boyfriends, girlfriends, any developmental issues, marital status, strengths, religious, spirituality, education, any employment situation, any job history, any employment interests or skills if they're looking for a job of some sort, any kind of special needs they may have. As far as the kids, if they're in school, if they're on an IEP, any interpreter needs, their primary language, any employment history. And then this is their mental health history. We'll talk about any previous treatment at different clinics, who their provider was, any inpatient treatment, hospitalizations, when, where, and why, any medications they've been on in the past that have worked for them or haven't worked for them, any history of substance abuse, any drug and alcohol treatment that we want to know about, any family history of mental illness or substance abuse we want to know about, any legal history, any criminal justice history in their past when they were kids, any time in prison, any current court proceedings that they're involved in, any history of juvenile court, specifically related to child abuse, neglect, or dependence, Trauma and abuse history is important. That's all going to be listed here. Any medical history that we'd want to know about would be listed here. History of current risk of self-harm, risk of harm to others, something we want to be aware about. Any community supports that we would want to be aware about. Any clinical information as far as, basically it just summarizes their story, where they came from, where they are right now, and where they want to go. The diagnoses would be here, and it basically tells us also why that diagnosis was chosen and why it is appropriate for the patient. So again, that is super comprehensive and really worth your time to review, and it's really important to review it. So we'll get out of this, and then we'll go back into the chart. And then we can also look at the health history questionnaire, is the other piece of information that we always want to have before our first appointments with patients. And this basically just is like a medical history, tells you who filled it out, when it was completed, when their last physical exam was, who they saw, any medical history, any problems that they're having currently, anemia, blood pressure issues, cancer, diabetes, headaches, brain injury, history of heart disease, any stomach, bowel problems, sexually transmitted diseases. And then there's also problems related specifically to psychiatric concerns, anxiety, depression, bipolar, hyperactivity, any sleep disorders, any history of suicide attempts, any hospitalizations for surgery or any medical conditions, their pregnancy and sexual history, any medical symptoms they've had in the last 60 days, diarrhea, chest pain, constipation, nosebleeds, panic attacks, seizures, all things like that that we want to know about, especially when we're prescribing meds. And then finally, we talk about pain, any immunizations, make sure they're up to date on their immunizations, their current height and weight, any nutritional concerns, their eating and their drinking, any issues with their digestive systems, nausea, vomiting, troubles chewing or swallowing. And then here's where the nurse would be signing off on it. That's all information that we want to know before we're meeting with a patient, especially for the first time. Other information that we want to look at for an appointment, which is important before we talk to patients, is we want to look at either previous nurse practitioner notes, previous MedSom notes, previous therapy notes, or previous nursing notes. So this is where you'd find them, is under path documents. So this would be where your therapy note would be. And you would click on this and just kind of take a quick view at it, see what they've talked about in their most recent session, just to see where they're struggling, just so you know a little bit more about what's happening currently in their lives. And to make sure also that they're being compliant with treatment and compliant in therapy. So then we go back again, and then we can look at, under path documents, we can look at therapy notes, and then we can also, another note that's important to look at is the nursing note, just to see what's happening when the nurses are talking to them, what they're reporting, if there's any changes in their health history, anything that's going on with them medically, any side effects of medication, any concerns that they have related to medication dosing or sleep, any changes that they've had since they started meds. That's important information to review as well. And then once we review those things, we can then prepare for the actual appointment itself. So we'll go back to this face sheet, and you can access the appointment either through the face sheet here, where you could click on this and it will open up the appointment, or I like to go through my schedule just to see them from there. And at this point is when we would open the appointment, we talk to patients, we have all our information that we needed, have our conversations with them. And then we go back here to start charting on that communication that we had with the patient. And the next session is when we'll review the documentation that we'll do for those appointments and how we sign off on notes, etc.